Welcome back. Today we're going to run through 10 MBLEX practice questions. Pause, then check your answer. Perfect for quick review. Let's get to it. Question number 1. Determining the angle at which a joint moves with the least resistance is known as A. Direction of ease, B. Resting position, C. End, feel. The answer is A. Direction of ease. Finding the angle where a joint moves with the least resistance is called the direction of ease. It represents the joint's path of least resistance determined by joint flexibility and the stiffness of surrounding tissues. Question number 2. When more than one relationship with a client is present, this is known as A. Scope of practice, B. Dual relationship, C. Countertransference. The answer is B. Dual relationship. Dual relationship, also called multiple relationship, is when a massage therapist has a second role with a client, such as friend, employer, family member, or business associate, in addition to the therapeutic relationship. Question number 3. Massage increases available amounts of feel-good chemicals in the body, such as dopamine, oxytocin, and A. Serotonin, B. Cortisol, C. Epinephrine, adrenaline. The answer is A. Serotonin. Massage raises serotonin, a neurotransmitter that promotes well-being and relaxation. Cortisol and epinephrine are wrong because both are stress hormones. Cortisol is linked to chronic stress and tension, and epinephrine triggers the fight or flight response. Question number 4. Postural muscles are A. Made up of cardiac muscle tissue that contracts rhythmically, B. Composed of slow twitch, red fibers that sustain a fully contracted state for long periods of time, C. Primarily smooth muscle fibers controlled by the autonomic nervous system. Answer is B. Composed of slow twitch red fibers that sustain a fully contracted state for long periods of time. Postural muscles, like those in the back, neck, and legs, are mostly slow twitch, type 1, red fibers. They're rich in myoglobin and mitochondria, highly fatigue resistant, and built to hold you upright for long periods. They're voluntary skeletal muscles you can control consciously for actions like standing, walking, and lifting. Where within a joint would you find hyaline cartilage? A. Joint capsule, B. Synovial membrane, C. On the articular surfaces of bone ends. Answer is C. On the articular surfaces of bone ends. Hyaline cartilage covers the articular surfaces of bone ends and synovial joints. It forms a smooth, low-friction, load-bearing surface that allows bones to articulate with one another and absorb compressive forces. It is not part of the synovial membrane, which is a thin, vascularized lining that faces the joint cavity and produces synovial fluid, nor is it part of the fibrous joint capsule, which is dense, collagenous connective tissue designed for strength and containment rather than a smooth, compressible bearing surface. Question number 6. What is the name for the volume of air moved in or out during a normal resting breath? A. Tidal volume, B. Residual volume, C. Inspiratory reserve. Answer is A. Tidal volume. Tidal volume is specifically defined as the amount of air that moves in and out of the lungs during normal, quiet breathing at rest. Think of it like the gentle tide of the ocean going in and out regularly. Question number 7. A condition where tissue repair and maturation do not progress normally and the tissue enters a recurrent inflammatory process is called A. Acute inflammation, B. Scar formation, C. Chronic inflammation. The answer is C. Chronic inflammation. The normal healing process should progress through inflammation, tissue repair, maturation, remodeling. Chronic inflammation occurs when tissue gets stuck in the inflammatory phase and keeps cycling back into inflammation instead of resolving and moving forward. Question number 8. What is the condition called when someone loses their sense of smell and taste? A. Paresthesia, B. Anosmia, C. Hyperesthesia. The answer is B, anosmia. The condition called anosmia means a complete loss of smell. The word breaks down to an, meaning without, and osmia, meaning smell. Hyperesthesia is not correct because that term means an increased sensitivity to sensations, the opposite of losing sensation. Paresthesia is also incorrect because it describes abnormal sensations like tingling or pins and needles, usually related to touch, not smell or taste. Question number 9. What is the body's immediate physiological response when tissue is injured? A. Fibrosis. B. Edema. C. Inflammation. The answer is C. Inflammation. Inflammation is the body's immediate comprehensive physiological response when tissue is injured. It's the protective process that kicks in right away and involves vasodilation, increased blood flow. It produces the classic signs: redness, heat, swelling, and pain. Question number 10. What is the process where circulating leukocytes are attracted to an area of injury? A. Chemotaxis. B. Diapedesis. C. Phagocytosis. The answer is A. Chemotaxis. Chemotaxis is when leukocytes are chemically attracted and move toward an injury or infection. Diapedesis is the step where they squeeze through the vessel wall, and phagocytosis is when they engulf and destroy pathogens after arriving. 10 MBLEX practice questions done. Leave a comment, drop a like, and subscribe for more. See you next time. Deuces.